Okay, so as you guys all know, we have discussed about the introduction of the blood. Now, as you guys all know, we discussed about that the blood is divided into the two parts. Parts. That one was plasma, and second was corpuscles. Okay. So if we talk about the corpuscles, that we'll be discussing in next video. But today we'll be discuss about the plasma, the composition of the plasma. So plasma is composed of 55% of blood, and corpuscles is composed of 45% of blood. Okay. So now if we talk about the plasma, so the composition of the plasma. So plasma is composed of 90% of water. 90% of water. If we are talking about the plasma, okay. And 1% of the inorganic salts, for example, sodium, chloride, and calcium, potassium, and you can say that bicarbonate ions, okay. And 7 to 8% of the proteins. Which protein? Plasma protein I'm talking about. For example, serum albumin, serum globulin, that we'll be discussing too. And 1 to 2% is composed of the dissolved food. Dissolved food, or you can say that the digested food or waste substance, okay. Waste substance, dissolved gases like carbon dioxide, oxygen, okay. So if you will total this, so that will be 100%, okay. So this is a 100% composition that in plasma. First of all, we will be discussing about all in detail. First of all, if we talk about that the proteins, yes, 7 to 8% protein. For example, plasma protein we are considering, so that is serous albumin. That is basically a protein, okay. And that can cause a edema. What is edema? Edema is basically a swelling of feet, okay. If serous albumin is less in our body, or that can is causing a deficiency, that can cause a edema in our body. What is serous albumin? This is basically a protein that work in osmoregulation, okay. And in this protein there is a lot of water, okay. So from plasma, water will move to the tissues or cells, and it will cause edema, okay. Now our next protein, that is serous globulin. This is also called immunoglobulin. So immunoglobulin, which means it is related to the immune system, which means that it is having an important role in formation of antibiotics, okay. Antibiotics, okay. Now if we talk about the next protein, that is clotting protein, okay. We are also calling that as a that can also cause heparin disease. What is heparin disease? That I'll be telling you too. Heparin, not heparin disease, that will through this the heparin will decrease, that I'll be telling you. But first of all, let's talk about the clotting protein, okay. This is also called, they are having a protein that is the prothrombin. These are the clotting factors, okay. Prothrombin, fibrinogen, these are what? These are the clotting factors, okay. So their secretion, well, when their secretion, the clotting protein, when their secretion will increase, okay. So if there is any like wound is there, any accident is there, so these clotting factor will, like you can say, prevent the deficiency of blood, okay. So through this, the clotting factor, these are very important in our body. If there is any wound in our body or like that, so that would like prevent the blood clotting, okay. The opposite of this clotting protein is anticoagulant. What is anticoagulant? This is basically a heparin, okay. This is like when blood is flowing, heparin can be anticoagulant. Okay, what is anticoagulant? When blood is flowing, so the heparin will increase and clotting protein will decrease, which means that like to transport the blood easily, like the clotting factor will get decrease and heparin will increase, so the blood will easily transport. Okay, so the clotting factor will get decreased, so which means they both world antagonist. Okay, so in when the clotting protein is there, so the heparin will decrease. When the heparin is there, which means that there the clotting protein will decrease. Okay, now if we talk about the dissolved food and waste substance, so if we talk about the waste substance, so waste substance we are having that is in plasma, that is urea, ammonia. These are what? These are the waste substance. Uric acid. Okay, so we are having uric acid 2, and next we are having a keratinine. Okay, we are having urania 2. What is urania? Urania is basically a disease. Okay, when blood substance when in blood or in plasma, the you can say that these waste substance get increased, so that can cause a urania. This is basically a disease when waste substance got increase in the blood. Okay, if we talk about the dissolved food, as you guys all know, we have discussed in the composition of the plasma dissolved food, that can be a, as you guys all know, the dissolved food we are having amino acid like through protein, lipids we got the fatty acid, glycerol. Okay, as well as glucose, the main you can say that the energy, you can say substance through which we are getting energy. Okay, if we talk about the glucose, so glucose is basically 80 to 100 ml normal, normal in adult. Okay, when the glucose level is getting increased, that means when the glucose level is get increased, which means 180 ml above, this one is normal. If you're talking about the increasing, so that can cause a hyperglycemia. Okay, this is a disease. When the, like you can say the through the you can say that when this is normal 80 to 100, when the glucose level is decreasing to the 80 ml, like 70 ml, 60 ml, 50 ml, that which means the glucose level is low, that can cause a hypoglycemia. Okay, hypoglycemia, this was the hyperglycemia, that which means the increasing of the blood, or not blood, glucose level. Okay, and these are what? These are the, you can, as you guys all know, in the previous video through the digestion we discussed about lipids. So through fatty acid and monoglycerol we have discussed that there was the formation of the chylomicron, and that was like dissolving through the blood vessels in the lymphatic system. Okay, now if we talk about the proteins, that is in plasma, proteins we are having, like you can say that we are having proteins, we have discussed. And if we talk about the vitamins, so the most vitamin, that is E, K, and vitamin B6, vitamin B12. Okay, these are present in the plasma. If we talk about the hormones, so we are having a ductless gland in endocrine system. So these all, they're all secretion of their glands that include in the plasma, like insulin, glucagon, gastrin, growth hormone. Okay, we are having these all hormones. So if we talk about the enzyme in plasma, they are selected enzyme, important enzyme I'm talking about, that is ATPase, cholecystokinin. As you guys all know, this enzyme we have discussed about this enzyme in small intestine too. Okay, and you can say that these are basically in plasma. But if you talk about the corpuscles, which means white blood cell, RBC, they are having different enzyme that we'll be discussing in the blood corpuscles. Okay, so this was about the composition of the plasma. In the next video we will discuss about the corpuscles in which the blood cells are included, like RBC, WBC, platelets. So that will be also discussing in detail in the next video.